Hello, I am Mirella Nardo. I'm an editor fellow from the JIPO, the Journal of Immunotherapy and Precision Oncology, and today I have the pleasure to interview Dr. Lee. Hello, Dr. Lee. Thank you for being here with us today.
Thank you. Thanks for having me.
Dr. Lee holds a PhD degree and currently is the Senior Vice President and Chief Scientific Officer at New Immune Tech, and he joined the New Immune Tech in 2016, and he leads a clinical and translational program. So today we're going to talk about the article that Dr. Lee recently published at JIPO. So the name of the article is the Role of Interleukin-7 in the formation of tertiary lymphoid structures and their prognostic value in gastrointestinal cancers. So, Dr. Lee, thank you again so much for being here with us. We had a chance to read this incredible article, and we've learned a lot because you are talking about something translational that not always we have contact in the clinic. And we are happy to see the era of immunotherapy in oncology. But we also know that some patients have the benefit, not all of them, and one of the things that we want to understand is why not all the patients are responding to this treatment and what could we do for them. So my first question about this article would be that I understand you explained a lot about the tertiary lymphoid structures, and that this is one of the variables that could help us to predict the success of immunotherapy, specifically in GI tumors. Could you first explain for the audience the idea of the TLS and how it is related to the tumor?
So lymphoid infiltration into tumors has always been a target for applied immunotherapies. So tertiary lymphoid structures act as source for the tumor infiltrating lymphocyte, but also represent a complex and coordinated effort by the immune system to respond to the tumor. So as we describe in our review article, tertiary lymphoid structures contain many specialized cells with the ability to form vasculature, coordinate recruitment of naive T cells, presenting antigens, and support lymphocyte development and survival and expansion. So tertiary lymphoid structures allow us for in situ tumor antigen priming, B and T cell maturation and expansion of less differentiated lymphocyte, all are within the confines of the tumor tissue itself.
Very interesting. And I also found very interesting to see that this could be a predictor of overall survival, and in some cancers, it could be a predictor of response to immunotherapy. Do you believe this correlation has also a cause-effect relationship, and that if we can stimulate those TLS, we may improve the response to immunotherapy?
Yeah, thanks very much for the really great question. So yes, certainly, we believe there is a strong relationship between tertiary lymphoid structures and the response to the immunotherapy. So we hypothesize that TLS, which is called the tertiary lymphoid structure, are the potent mediators of immunotherapy-induced anti-tumor responses. However, TLS in some cancers have received little clinical investigation, which we hope to draw attention to here. So we point out in our review article that indication, location of TLS within the tumor, and the makeup of these TLS can all impact prognostic relationship with respect to clinical outcomes. Therefore, understanding the exact cause and effect of relationship in a clinical setting will require more time and continue to correlative studies across the clinical trials. And also, as we also discussed in our article, adequate understanding of TLS and their relationships to the immunotherapy responses require technically complex approaches. So over the past decade, the surge in the technology and our understanding of the TLS have primed the field to make the necessary jumps to drive deeper into investigation of the TLS in the tumors.
Very interesting. Well, it must be very complex, but I was wondering then another question, how could we act on these structures to help the response to immunotherapy?
Yes, actually, many cancers lack sufficient T cell infiltration or mature tertiary lymphoid structures at baseline, which may be important for the efficacy of the immune checkpoint inhibitors, or any approaches seeking to enhance anti-tumor T cell responses. So, mechanism driving TLS formation must first be established. So we believe that driving formation of tertiary lymphoid structure in tumors through therapies such as alpha-interleukin alpha, which is a long-acting interleukin-7, which our company is focusing on right now, will be a critical component of successful immunotherapy combination strategies. So ongoing studies will reveal novel avenues for leveraging the tertiary lymphoid structure through therapeutic modulation moving forward.
Very nice, very interesting. This kind of knowledge brings us hope in our fight against cancer. So it's very good to know new approaches, and when we learn new things and we can plan new ways to fight against it, it's impressive. Thank you so much, Dr. Lee. I'd like to thank you. I'd like to thank you again for being here with us and bring such a complex idea, complex studies and knowledge, and to explain this to us and to the whole audience. I'm sure everybody is learning a lot with you today. Thank you so much.
Yeah, thanks for having me again, and thank you to Dr. Nardo, and thanks for the JIP or all the editors having also great opportunity to be published. Thank you very much.
So, as a JIPO editor, I want to thank also the Journal of Immunotherapy and Precision Oncology. And here I'm showing our Twitter, LinkedIn, and YouTube. And if you like this interview and if you like the approach we're taking, please follow us and you will see much more content. Bye, and thank you very much.